Hi, my name is Dr. Jessica Probst, and I'm the founder of Thrive Again Physical Therapy and Wellness. I'd like to take a minute or two today to talk with you about urinary incontinence. That's when you can't hold in your pee. Urinary incontinence is something that many people who have had children have been told to live with. It's normal, some people say. Just try not to cough or sneeze or ever laugh, and then you won't wet yourself. I believe that there's a better way of doing things and that you can have significant help, and this is not something you should just have to live with. So let's take a moment to talk about the anatomy that's going on. So this is your pelvis. This is a model of the pelvis. So here's the pubic bone in the front, and then when we look inside here, here's your bladder, and up here is your uterus. If I'm rotating this down now to the underside, we see the pelvic floor muscles. There are muscles towards the surface and deeper muscles, and these muscles play a very important role. They need to be able to activate efficiently and effectively in order to help hold in your pee. So the problem comes when these muscles are not doing what they need to do in the way that they need to do it. So many of us have heard of Kegels. Kegels is when you activate the muscles in your pelvic floor. You try to squeeze and lift up the muscles in your pelvic floor to help strengthen those muscles. That makes sense. If the problem is that a muscle is weak, strengthening it is a great idea. So if my biceps muscle was weak, biceps curls would make a lot of sense. The problem is, in many situations, that is not the case. A lot of times what happens instead with our muscles is that our muscles are too tight. So if it's not just that my biceps are weak, if it's actually that my bicep has gone into spasm and it's so tight that I can't straighten out my arm, I'm going to have a problem and this muscle is not going to work very well. Let's say I wanted to have a swig of water. If I need to reach out to get my water bottle and then drink it, but I can't because my arm is in this tight position. Doing Kegels in this situation would be like doing biceps curls. If I'm stuck in this position and I can't reach out to do my functional activity, doing biceps curls is not going to help me, right? What do I need to do instead? I probably need to help stretch out that tight muscle, maybe massage it. Makes more sense, right? After I do those things, then I can take my weight and I can strengthen my biceps muscle. But it's not going to work if I do it when my arm is still in a stuck position. So, when you are having problems holding in your urine, what you need to do is see a pelvic floor expert who can carefully evaluate what's happening with your muscles and see, is it just that they're weak? Or some of those muscles tight and so tight that they're not able to function normally? Because if that's the case, we need to help free them up before strengthening to get you the relief that you need and be able to do basic things like coughing and sneezing and maybe even laughing without having problems. Let's talk more about your individual case. Give us a call at 202-803-2068, or you can send an email to info@thriveagainpt.com. We'll schedule an appointment for you to talk for free with one of our highly skilled expert pelvic floor therapists so we can determine, and you can determine, if pelvic floor physical therapy might be right for you. Thanks for watching.